from the sky. She speaks to me, and through melody lingers.
No matter what discipline, dressage, jumping, or western, both horses and riders face the difficulties of preventing and curing career-ending injuries. Regenerative medicine for equines not only offers a treatment that allows the horse to comfortably live out the rest of their life, but provides the possibility of returning to the competition life under sound and healthy conditions. Regenerative medicine is the use of scientific methods and medical technology that is utilized to recreate cells that are damaged or harmed in an injury to reduce long-term effects and allow healing to a fuller degree. The simplest forms of regeneration occurs in a flatworm called planaria. Planaria have one of the simplest centralized nervous systems known to science, which allows cells to send signals which are triggered by damage to the organism. Certain signals activate the neoblast cells, which are cells that are similar to human stem cells, and are able to transform themselves into any type of cell from nerves to tissue, allowing the planaria to regenerate damaged parts of the body. Pictured here is the concentration of neoblast cells highlighted in yellow, compared to tissue and nerve cells colored red. Unlike human cells, neoblasts are always totipotent, meaning they can transform themselves into any type of cell, depending on what the organism needs. A common experiment conducted is the regeneration of a second head, where the original head is sliced in half and is able to regenerate the missing cell through the use of neoblast cells.
A stem cell is a cell that has the potential to differentiate or progress or develop into another cell line.
Stem cells are special types of cells that, depending on their stage of development, can transform into different types of cells like skin cells, blood cells, nerve cells, or tissue cells through the process of mitosis.
A cell will undergo mitosis to form two new nuclei, and then divide to form two new individual cells during cytokinesis.
Within the term stem cells, there are more specific types of cells, which are named according to their stage of development. The least developed are called totipotent stem cells. These cells have the capacity to form an entire organism because there are no restrictions. Totipotent stem cells can be extracted from a zygote, which is an ovum that has just been fertilized. Pluripotent stem cells are slightly further developed and are derived from totipotent stem cells. The pluripotent stem cells can develop into any type of cell except for the cells that make up the extraembryonic tissues, meaning tissues that support the placenta, umbilical cord, and amniotic sac. They can be harvested from a blastocyst, which is the blastula of an embryo, consisting of an inner mass, a cavity, an outer layer, and the trophoblast, which nourishes the embryo. Multipotent stem cells possess the ability to differentiate into a still various but more limited number of cell types. These cells can transform into cells of a closely related family. Multipotent cells are considered adult stem cells because of this quality. One example is found in bone marrow. The cells can become almost any type of blood cell that the body needs, but are no longer able to become any other type of cell, such as a skin cell or a nerve cell. Stem cells in equines are typically used to treat tendon and ligament tears. Tearing is often caused by the combination of high impact applied to the joint and a lack of muscles to support the ligaments and tendons, or simply poor conformation of the animal, which causes them to be prone to injury. Ligaments connect bones to bones, and tendons are composed of tissues that connect muscles to bones. Both are required to be strong and supported by muscles in order to reduce the chances of tearing. In high-impact sports such as racing, jumping, reining, and high-level dressage, the easiest way to keep your competition horse happy and healthy is to train slowly and wait for muscle mass to accumulate through strengthening exercises. It is also important not to rush horses into competition or high-level activities that strain the ligaments and tendons where muscle is lacking. Injury is not completely preventable, however, and stem cell treatment is one of the most successful and effective ways to get your horses happy, healthy, and back into competition.
We've been doing this for about 4 years, and we've probably done, I don't know the exact number, but somewhere in the neighborhood of 50 to 60 horses. And I'm old, and I'm the historical control because I know what tendons and ligaments healed like before this treatment. And we have had some very impressive cases.
There are many types of stem cell therapies used in horses. One commonly used type is called an adult bone marrow-derived stem cell. They are typically extracted from the sternum and then cultured for 2 to 3 weeks in order to grow enough to regenerate the torn tissue. The solution injected into the animal is called bone marrow concentrate, or BMC, and is often used to both treat severe arthritis and the same type of tendon and ligament issues as previously discussed.
After we block the area, we make a stab incision into the skin, and then we use a 11 gauge Jim Sheedy needle to go into the sternobra, approximately 1.5 inches deep, and then we will aspirate into
Bone marrow is the soft tissue found in the hollow interior of bones, which is meant to strengthen the bones and produce large numbers of blood cells, both red and white. This means it not only provides the basis of regeneration with the red blood cells, but prevents infection with an immune response from the white blood cells. BMC can also be combined with adipose tissue-derived mesenchyme multipotent stem cells, and when they are combined, they create BMMSC. Adipose tissue is made up of fat, therefore extracting stem cells from adipose is much less invasive than bone marrow extraction, and is usually taken from the hip instead of the sternum.
Fetal fibroblasts are a final type of stem cell often combined and used in therapies. These are often extracted from PMU horses' umbilical cords and fetuses. PMU stands for pregnant mare urine, and the horses are only bred for medical purposes and are often treated and cared for poorly, as well as overbred and sent to slaughter. These types of cells therefore carry the most controversy and difficulty to obtain. The only real reason to use this type of stem cell, however, is to reduce the scarring and act as a reservoir for healing growth factors. They can reduce scarring since embryonic skin heals so quickly and seamlessly, but PRP is a more effective reservoir for growth factors.
Platelet-rich plasma, or PRP, was first studied on digital flexor tendons and suspensory injuries. In order to create PRP, the ratio of platelet to different aspects of the bloodstream is altered to 2 to 4 times greater concentration of platelets than natural blood carries. Platelets alone are used to treat less severe tears than stem cells, and are most effectively used to reduce acute inflammation if distributed within 6 months of the date of the injury. PRP and stem cells are often combined at the injection site in order to heal the animal to the largest possible degree. However, PRP and stem cells should not be mixed in the same syringe because the PRP may cause clotting, making the liquid difficult to inject. The PRP treatment is fairly affordable as it ranges from $600 to $1,000.
A platelet is made of 2 main components and also naturally found in the body. The first is a variety of 200 proteins, and the second is a specific protein called a growth factor. Growth factors are proteins that regulate cellular metabolisms and reduce inflammation, which decreases the pain and allows blood to flow through to the damaged tendons and ligaments. Activation can be used to synthesize growth factors, which is done through the process of adding calcium chloride to the platelets. The PRP solution is then placed into the centrifuge in order to separate the PRP from the rest of the blood sample. A transportable cell-side centrifuge must be used because the solution must be re-injected into the body within 10 to 15 minutes in order for the PRP to survive.
In order to inject the cells into the correct location, an ultrasound must be used to allow for the veterinarian to see the needle and soft tissue that is damaged. The recovery process is expedient, and hand walking is the first type of exercise that horses are reintroduced to because it is the best way to reduce inflammation. This is due to the fact that horses have arteries protected by the outer casing of soft tissue called frogs that pump blood up their legs and into their body. Stem cells have shown to not only be more effective than previous methods, but also cost effective ranging from a total of $2,000 to $3,000.
In one case study, 11 racehorses were treated with MSC compared to 15 control horses. Since horse racing puts high stress on ligaments and tendons, it is extremely common that they sustain a re-injury within 1 year of typical treatment. However, 82% of the horses with MSC in the case study returned to racing within 9 to 12 months, and 100% of those horses showed no re-injury after 2 years, while all 15 control horses were re-injured within 1 year of beginning to race. Surgery was the most common method of treatment for ligament and tendon injuries before regenerative medicine. Suspensory surgery is one example and is a major surgery in which the horse must be transported to the veterinary clinic and completely laid out and put on the operating table. The injured leg is then sliced open and the nerves and inflamed pieces of the ligament are removed in order for there to be room for the suspensory to move freely without pain. The surgery costs anywhere from $5,000 to $6,000. However, nothing is actually done to heal the ligament. Regenerative medicine is transforming the healing process of horses around the world and bringing great technological and medical advancements to the veterinary field. It is also much more affordable, effective, and fast in comparison to previous methods. Although regenerative medicine in equines does not have the years of data backing it up, the data that is presented proves its effectiveness and potential to change the lives of equines around the world.